So I put drains in for all my explant surgeries with or even without a lift. The reason I put drains is multifactorial. So we're taking out the implant and the whole capsule. So it's a lot of raw surface area and a huge space in there. So even if I do a muscle repair to close that space, I auto augment and fill in that space with your own breast tissue. There's always fluid that can build up, especially in the armpit and the side of the chest wall area, and we don't want that fluid living there. I also wash out the entire pocket with a ton of antibiotic irrigation. We're presuming that this pocket is contaminated with the bacterial biofilm, so I want everything washed and drained out. So I put drains in to help collect all that post-surgical fluid that builds up there, because if we don't put drains in and that fluid builds up there, guess what's going to happen? It's going to fester there, you're going to get an infection, and we are going to have to drain that fluid in the office with a big needle, and that is not a comfort experience. So we have a great insurance policy with the drain. The risk of infection is minimal with that. We leave them in for about 3 to 5 days. They serve their purpose, and then we pull them out. So I know some doctors don't put drains in. I do always question what their seroma rates are when they have to aspirate. What they typically do is they'll have the patients confined to this TRex position and they're not moving their arms. And so when they're not doing that, they're at risk for getting a frozen shoulder. They're at risk for getting fungal infections in the armpits because you're kind of holding there and moisture builds up over there. And you're blocking all the lymphatics to your arms. So your hands get super swollen and you get numbness and tingling. When I do muscle repairs, I want my patients gently moving their arms around. I don't want that frozen shoulder. I want to start activating that muscle. And so we want movement, and functionality is important. So we're doing the explant, we're doing the capsule removing, doing the muscle repair. Functionality is super important after the surgery. And so we want the arms to move. So yeah, that's going to cause a lot of fluid buildup, and the drains are there to help protect that fluid thing. So I think drains are super important. 3 to 5 days, they're out, and then you're on to your next phase.